Hi, Tribe. We're here with Janie. I worked with her when I was travel nursing. It was a privilege, and I learned so much and had a great time into the travel world with Janie. She also is a camp nurse, so I've asked her to come in, and she voluntarily said, let me do a critical thinking for you guys. So we're going to get to talk to Janie a little bit and get to know her and what brought her into camp nursing, and then we'll go into some scenarios based on camp nursing themselves. So, hi, Janie.
Hi, nice to be here.
Good. So how long have you currently been doing camp nursing?
Wow, I have done camp nursing for about the last 10 years now.
Okay.
So, and I'm actually more of the backup nurse and I do the healthcare management.
Oh, okay.
And so I'm the only nurse with pediatric experience at the camp. So that helps a lot as with the backup, but I usually am supporting because I have a number of other roles that I'm doing as well.
Okay. So you're wearing many hats as normal for your life.
I,
All right. So
yes.
what did you do prior that prepared you for camp nursing?
Well, I was a staff member in the camp, and I've been a staff member now for about the last 27 years. And so have kind of worked my way up. I was a counselor, and then I was a division director, and then I went into being the registrar office manager, and that's kind of about the time that our long-term nurse had been thinking about retiring, and so kind of moved into, I did camp nurse for a couple of years and then took over. We were able to find somebody else and then support them with being the healthcare manager.
Okay. Very cool. So what do you think? Is this a good place for a brand new nurse to start in camp nursing?
It can be. It will definitely stretch you, and it will make you think a few times of like, what am I doing? But I don't think it's really any different than when you're first starting out in a hospital or clinic, whatever you're choosing for your position. So you just have to know that that first year is going to be kind of on the rough side, and then just keep going with it.
Okay. So is there on the job training available for camp nurse then?
Sometimes there is. At my particular camp, we would do on the job training. And that's why I'm there to support the other nurse because I do have
Okay.
the pediatric experience. But there is some classes and conferences that you can get through the Association of Camp Nurses. And I have that actually at the end of my presentation for people to refer to. So
Awesome.
there are classes and stuff that you can do, but it is a lot of on the job training.
Okay. So what is there any characteristics specifically that you would say make a strong camp nurse?
Strong camp nurse would be that you have to be organized,
Hmm.
you have to be thorough with your documentation, and you need to love kids. You need to
Awesome.
know what your developmental stages are with your kids because you're going to have them from all walks of life.
That's great. Do you have a specialty camp that you do, like a certain illness or something like that?
No, my camp that I do is generally well kids. We
Okay.
mostly take care of kids that have seasonal allergies or they will have like asthma exacerbation is kind of the
Okay.
worst. We have had a couple of diabetics, but no, we're not particularly focused on one type of illness.
Okay, cool. All right, I'm going to let you get into your scenarios. If anybody has questions for Janie along the way, I'm kind of the moderator of this one. It's a treat for me. So I'm just going to put her presentation up. She's going to do the presentation, but I'll be able to read your questions as they come through if you have something specific. So, Janie, I'm going to let you steal the show. Here's your presentation, and I'm going away.
Sounds great. So today we're going to talk about critical thinking as a camp nurse. You think that going to camp is going to be all sorts of fun and games, but really there are times and situations that you'll see that you really have to use those critical thinking skills that you've learned in school or along the way in your professional life. So on the next slide, we talk about the role of the camp nurse. And really, the role of our camp nurse is that we want to make sure that we're ensuring the health and well-being of every camper and staff member who is on our campsite. And so how do we do that? We do that by assessing their health status when they're arriving to camp. And we want to make sure like they haven't had a fever in the last couple of days or they haven't been sick. We want to also know like, are they coming from another camp? And because that's going to add to their level of fatigue. We want to know if they're having any medications that they take routinely or just as needed. And did they bring those with them? We make sure that the medications, what the parents have written down on their health form, matches what is on the prescription. We want to make sure that we're comfortable with our camp's health policy. At my particular camp, our health policy is always reviewed by a physician and signed off on it every 3 years. So those are kind of like our standing orders that we go by. So we're covered within with our scope of practice by following those orders. You also need to be ready for any emergency that can arise. And as we go through some of the scenarios, you'll see different scenarios. And you'll see that they can vary from pretty minor to what could be pretty major. And then also you need to be very aware of the physical and emotional stages of development for kids, because you're going to get kids from all walks of life. And so we want to make sure that we're well versed in what the developmental stages are. And especially if you're with a specialty camp of any sort, you want to be really in tune to what your population is that's there. And most of all, you want to be kid friendly. You don't want to be that nurse ratchet that no one ever wants to go to. So how many nurses are usually at camp? That depends on the size of your camp. My camp in particular, we only have about usually 80 people per week. And so we have 1 to 2 nurses on site. So I count as one. I'm the backup nurse. And then we have another one who does that full time. And I just get called in for consulting. So what kinds of conditions do we treat? We treat anything from bug bites or insect stings to traumas. We do a lot of homesickness. Chronic illnesses can be something, especially if you're working at a specialty camp, and there are a number of those out there across the United States. Can be a burn camp, or you can deal with burns as well, from sunburns to falling into the fire. There's also heat stroke, heat exhaustion, dehydration, especially with this global warming, how we see our temperatures changing. And kids are not used to being outdoors. They're used to being indoors where it's a little bit cooler. And so making sure that they're drinking lots of fluids, lots of water. Animal bites could be something, depending on the location, and then definitely trauma. And that will be one of our things that we talk about in a little bit. So one of the things, our first scenario is a camper looks like they have lice. Lice always is that scary thing that makes you want to itch your head and like, what gives you the heebie-jeebies. So first thing that we need to know is it really lice? So a lot of camps do check when campers are arriving. And so my particular camp doesn't. I feel that's a little bit of an invasion of privacy. And it's not like we're going to treat the camper any different whether they have lice or not. You have to look at your policy on whether you send the camper home or not. At schools is how camps followed. So however schools treated lice was how camps treated lice. And so nowadays there's so many products that schools don't need to send kids who have lice home. They just notify the parent, and then the parent takes over for treating them. And so that's the same thing that we do, especially for my camp, is that if it looks like somebody has lice, then we will go and we'll get the RID treatments, and we start doing the hair washing and checking for nits. We will contact the family. But most of all, we want to look at prevention of spreading it to other campers. So we do a lot of education for teaching campers, don't share your hairbrushes or your hair accessories, don't share hats, don't share pillows, things like that. And then again, lots of good hand washing and lots of good personal hygiene to help prevent that as well. If the parent chooses that they want to bring their camper home, depending on the day of the week, we might let them do that, and then they can always bring their camper back if there's, a few days left in the week. It's the parent's choice ultimately. Can a camp nurse bring their children? Oh, yes, most definitely. We always love to have their kids there, especially if they are within the age groups that we're caring or we're providing camp for. Then we love to get those kids off and into cabins. So our second scenario is that we have a camper complaining of itchiness. So what type of an insect bite do you think that this picture is showing? So we're looking at most likely a mosquito. Yeah, perfect, mosquito. So our treatment for this would be that we would watch it for, we'd put in a histamine cream. So whether you have a Benadryl cream or cortisone cream, ointment, or Benadryl comes in a gel now as well. Putting that on, and then just monitoring the site. Some kids can really swell up, especially if they haven't really been bitten by a mosquito before. It could be their first time that they really have a histamine reaction. So we want to make sure that we're monitoring that site. So now it's the next day and the camper returns. So what are we going to do now? This looks like it looks like to be a cellulitis in progress, and I will have to say I've treated many of these at camp. And so what are we going to do? First of all, we're going to take our Sharpie pen and we're going to outline the area of induration. We want to make sure that we're watching how fast is the cellulitis traveling. And then we're going to be looking into getting the camper into for medical care. So whether it's during the day, you'll want to be calling the physician that you work with in the local area, getting them in for an appointment, or possibly taking them to urgent care. We don't want to really sit on this overnight, depending on the size of the induration, because we want to get those antibiotics in and treated. So then we take the camper in. They determine, yes, it is the cellulitis. What are we going to do? We're going to get the prescription filled, and we're going to make sure that we're giving that prescription to the camper as it's been ordered. We also want to continue to outline the area of induration because it could continue to grow, but if it continues to grow and it looks like it's worsening, we would need to take the camper back in for another view from a licensed prescription or prescriber. And most of all, we want to notify the parent that we've done that so that the parent is aware of what care we've provided and what the physician has said. So our next scenario is that we have a camper who appears sullen, he's withdrawn, and really not interested in participating in camp activities. So what do we do? So that's our first line of defense, is that our counselors are really working with the campers, trying to get them involved into the activities and making sure that they're having a good time. But sometimes they just have used up all of their skills in their tool bag. So they will bring them to the nurse and be like, I don't know what to do. I think that they're homesick, but so we assess that the camper is really not physically injured. Ask them what's wrong. Sometimes a different adult they might feel a little bit more comfortable with. It might be that they needed to just be one-on-one with an adult to tell them what's going on. They didn't feel comfortable in their cabin. You'll hear a lot of things being the nurse. And so this camper here has stated that they're homesick and that they really want to go home. So what are we going to do? We are going to talk with them. Then on our next slide, we'll show that we really don't want to let them go home. We don't want to let them call home. They'll always be like, I really want to call my mom, or I want to call my dad. And we have found, at my camp particularly, we found that the more that contact that they have from the parents, the more homesick that they can get. There are additional coping strategies that you can do to help them get through the days and nights. And that is doing a lot of checking in with them frequently, helping them to look forward to what is going to be happening in the day. Sometimes when their homesickness and their grief is so overwhelming, they can't see the future. And so looking out, like, what activities are you going to be doing before lunch, or and talking about that. Then check in at lunch and talk about, what are you going to be doing this afternoon? What are you going to be doing for free time? Hey, how about if I meet you at the pool for free time and we could swim together? So just kind of helping them to set goals throughout the day. We also want to really encourage the buddy system, not only for safety for a homesick camper, but also for safety just in general, that you always have a buddy or two with you as you're traveling throughout the camp. It's a very different environment than a camper's home. And so we want to make sure that they're safe. You'll see that I've also given you a couple of ideas that say the bread tag club. So that was something that I actually found online, and I thought that was such a great idea. Sometimes these homesick campers, they may have come to camp and they didn't have a friend with them. And so they want to be part of a group, but they just may not know how to go about doing that. Getting the tags off of the bread packaging is something that you could do, and have them, everybody in the cabin perhaps have a tag, and they can just clip it onto their shoelace or carry it around. And so anybody who has a bread tag is part of the club. And so that helps the homesick campers feel like they're included. Another one is fluffy friends. And so as a nurse, you'll find that you'll need a whole array of stuffed animals. And so it helps sometimes if a camper has forgotten their stuffed animal at home, it helps for them to have a stuffed animal for them to sleep with, or even sometimes just carry around for that emotional support for them. So sometimes it will be that homesick campers may get worse. And so you want to make sure that you're watching that they're continuing to eat and drink, and just being involved with the activities during the day. There are times when homesickness will get so bad that they do stop eating and drinking. And in that time, that's the time that you do need to look at sending that camper home. So what type of medical supplies are at camp is a question that has come up. At my camp, we have two kind of Craftsman red carts, that one that you would store tools in, but we store medications in one, and then we store bandages and splints and ice packs and stuff in the other. So we have a number of medical supplies. We also have had AED. The American Camp Association is the kind of the governing body for camps. And so if your camp that you're working at is a member of the ACA, then you are required to have access to an AED. And so that's one thing. We have it on our nurses' desk, and we have let our campers and our staff know that's the only time that they could go into the nurses' house without the nurse being there, is to get the AED, because it has been called for. We also do carry epinephrine in case of anaphylaxis, and we also have some Silvadene cream for burns, and we do have an albuterol inhaler in case of anaphylaxis as well, for asthma exacerbations. Do our parents know that their children can't call home? Yes, they do. We do give them that information. My camp in particular sends out a information sheet for parents. We call it the clue, to help the parents kind of clue into what camp is all about. And we do let them know that we don't allow campers to call home. We have a one-way camper email system, which is where parents can send campers emails, and then I print those off every day, and we distribute them just as we would distribute the mail. If a parent is really wanting to know how their camper is doing, they can always contact me on email or call me on my cell phone. I do let them know that if they're calling me, if I'm around campers, I will not be answering it. We try to be kind of technology free at camp. So in our another last scenario, this is one that actually happened to me about 5 years ago. I had a staff member who fell off his mountain bike and he landed on his head. So the situation is that he was leading a mountain biking and he rode over a dirt pile. We were having some construction at our campground, so we had some dirt piles. He tumbled off of his bike. He was using the pedal clips for the first time, and he wasn't sure how to get out of them. And so after he had fallen, he kind of brushed himself up, picked himself up, walked himself up to the cabin. And that was about a quarter of a mile. And as we progress through this scenario, you'll see why these things were all pretty amazing at what happened. So he got back to his cabin and then he notified the camp nurse because he felt like he had a clunky feeling in his neck. So what to do? So we know that he was wearing a helmet at the time of the fall. He did not have experience using the pedal clips. This was his very first time. And he was not following the rules of the director to stay away from the dirt piles. So the good thing of that was that he was wearing a helmet. So our camp nurse at the time was called to assess the patient. So she went over there to his cabin. She found that he was alert and oriented, but he was complaining kind of an achy and a clunky feeling in his neck. And he said, you can really feel it clunk. So soft collar. We didn't have a hard collar at the time. Put on a soft C collar, and she called the camp director for assistance. And then I was called after the camp director came and did his assessment, just because they felt that they needed to transport him to the local clinic for further assessment. So when I got over there, my assessment, you'll see on the next slide, was that yes, he was still alert and oriented. He was complaining of kind of this clunkiness feeling in his neck, although he was C collar. But the director happened to mention to me that the staff member's bike helmet had been cracked upon the fall. So I had previously had from my first job, it was required that I had taken TNCC, which is the Trauma Nurse Core Curriculum. And I remembered that having a cracked bike helmet is a warning sign because it can indicate that you have further trauma to your head and neck. So with that, I was like, no, I am not transporting him. And we need to call 911. So 911 was called for transport. They came, they got him off onto the backboard. And then they took him to the local emergency department about 30 miles away, and I followed and met them there with his health form. So at the hospital, to tell you, is we'll find out in just a couple of slides. We'll go to the next slide. I'll tell. So first of all, my recommendation is that you always want to follow your gut. And in this case, I followed my gut. I knew from my past experience with my trauma class that a cracked helmet is a no-no because those helmets are pretty tough. And so using my credit was like, I needed somebody who was a higher level of care to take care of this. So it was calling 911 and getting the medics out there. So following my health policy at camp, I knew this was something I shouldn't treat and I couldn't treat. And so I was practicing within my scope of practice. So at the hospital, then we found out, and I believe it's on the next slide, he did have an MRI and it was found to have fractured his C1 vertebrae in 3 places. The fact that he was still alert and oriented, he was still talking, he was breathing, he was not dead, was amazing. And so after the MRI, they were ground transporting him over to the local level 1 trauma center, which was about 120 miles away. And that's where he waited in the emergency department for a couple of days before he was able to have surgery to repair his neck. And he gratefully suffered sequelae. So it's using those skills, your assessment skills, your SBAR skills, your critical thinking is everything to need to be able to help your assessment of these patients. So there's just a few, those were just a few of the scenarios that we talked about. Those are scenarios that hopefully not the last one, but the first two or three scenarios are things that you would find out every day, or you would encounter most likely every day when you are at camp and as a camp nurse. But if you're interested in more about camp nursing, you can go to the Association of Camp Nurses. There is a website for it, and learn more about that. But I'm also happy to take other questions. You can contact me here on the tribe. And I thank Chelsea for letting me talk.
Awesome. Thank you, Janie. That was awesome. I loved those. Those are great. Yeah, like Janie said, if you guys have further questions, stick them in the comments here in the live feed and we can get back to you later. But thank you, Janie, for joining us. That was awesome. And anybody else that wants to do this, that was super fun. I enjoyed being the moderator. So
awesome. It was great. Thank you for having me.
All right. Have a great day, Janie.
Sure.
See ya. All right, guys, so that was awesome. If any of you want to do that with me in the future, if you have a critical thinking scenario that you want to share, bring it. I would love that. That was so cool. You don't have to do a PowerPoint and all that jazz either. If it's not applicable to yours, just bring it on. If you have an awesome case study that you did, you've got a funky chest tube situation that you found out about, that you did some critical thinking on in your current practice, bring it to me. I would love that. Your tribe would love that. And by the way, oh, you can't see my shirt. I got my tribe shirt on. It's exciting. I really like it. It's super soft and comfy. Those will be up for sale tomorrow. I didn't choose the one that you guys chose. You guys all chose that colorful one. I chose the flowers one and I love it. Have an awesome day, you guys. Thanks for joining me. You guys did great participating, and have an awesome, what's today? Thursday. Have an awesome Thursday. Enjoy your weekend if you get one. See ya.